It's Barb here, longtime professional home care, personal support worker, union steward, and certified member and co-chair of a joint health and safety committee. This video is going to be the continuation of my series on Peri-care, Peri-care Part 2, the male anatomy. I'm going to include a link to Part 1 because there's an introductory bit there that would help you before watching this video. So I'm going to get right to it. Again, I'm going to keep it as simple as possible. I may get a little clinical now and then, but I'll try to keep the terms easy to understand. And again, this is not a how-to video. This is a how I do it video. I again ask permission. If they cannot do it for themselves, I do it. If they need help, I assist them, but I always ask permission first. Now the anatomy, of course, being different from the female anatomy, the part that is similar is where the legs come up and meet the torso. And then you've got, as I sometimes call, the dangly bits. Remember, the generation I'm dealing with, so I choose euphemisms so they do not feel uncomfortable. What I do is, after getting permission, is of course do up those both sides, and then I run into some men who are not circumcised. I don't mind that at all. It's part of the care. When I get to that part, I again ask permission. That needs to be pulled back and cleaned. Is it all right if I do that? They'll say yes. And there have been times when I have pulled it back and there has been so much buildup that the buildup has solidified. And accompanying that will be what I call glow in the dark red. It's this bright, bright red, sometimes pain and itch. Sometimes there's even a yeasty smell. It's very important to keep these parts clean and dry as well. Because again, if there's anywhere on the body where things can go wrong, it's there. What happens when I run into that is I will advise them of what it is. I will advise them if it's just a slight redness. Sometimes they tell me to put Vaseline on if it's anything worse than that. And they'll say, just put Vaseline on. I'll say, you know what, it's a little beyond that. You need to speak to your doctor or your nurse. And again, making sure it's clean and dry. Powder, depending, can be used there, but only in where the legs meet the torso because, you know, it can get moist in there, especially when briefs are worn, and I'll attack that in Part 3. Again, finalizing, always make sure you have their permission. Be very gentle because it's delicate there as well. Always inform them of what you're doing. Talk them through it as you're going through it. And the experience should hopefully be not as uncomfortable for them as it could be. That is about it. So stay tuned, stay healthy, stay safe, and I'll see you on the flip side.